In this audio lecture, we're going to be continuing our discussion of urinary tract obstructions. So we've already focused on nephrolithiasis, hydronephrosis, okay, and now we're focusing on the tumors, and we've already posted lectures over Wilms, renal cell carcinoma. In this lecture, we're going to focus on bladder cancer, and then in the follow-up lecture, we're going to be getting some more information about benign prostatic hyperplasia. Okay, so bladder cancer. Okay. What is bladder cancer? Bladder cancer is going to be cancer of the bladder. Okay. It comes in various forms. So depending on where it is actually located at. And so if it occurs in the bladder or the ureters, it is known as transitional cell carcinoma, right? So transitional epithelium is going to be epithelium doesn't fit any one single category, and we only find that type of epithelium in the bladder because we have a structure that is expanding and it's compressing. Okay. We could have squamous cell carcinoma, and that's really in the urethra. So where we're going to find that at. Now, last but not least, we have adenocarcinoma, and that's going to be cancer of the mucous membranes. It is due to constant irritation and inflammation, due to garments and or infections. Okay. We could see that this can metastasize to other areas, and it occurs often. So it often metastasizes to the pelvic lymph nodes, liver, and the bone. Right. So we've seen liver in a couple different forms of cancer here. So these tumors form along the bladder wall and can infiltrate surrounding tissue. Okay. Overall, there are 77,000 new cases of bladder cancer reported annually, 16,000 deaths per year. So it has a fairly high death rate as well. Okay. So risk factors for bladder cancer include chronic irritation of the bladder. Right? And so this could be bladder infections, UTIs that are extending up into up the urethra to the bladder. And we know that age and sex can have factors. So increasing age can be a risk factor, but don't let that convince you that it only happens to old people, because it can happen to younger individuals as well. It is more common in men and Caucasians. Other risk factors can include chemical exposure, so individuals who work in industrial plants or have to deal with like chemicals for their job, like farmers have to deal with pesticides quite often. Those can produce bladder cancer. Okay. Chemical exposure can include smoke, excessive analgesics, okay, because that can oftentimes irritate the lining, inflame the lining. You could have infections, so like I said with UTIs, frequent UTIs, it's not just one or two, and prior cancer treatments. So all these are impacts. One other factor would be, or one other risk factor would be increased catheter placement, right? So if it's not getting changed often enough, it can create really a source for bacterial infection, which can irritate the lining of the urinary tract. And it also causes irritation of the epithelial cells lining that structure. So chemotherapy and radiation can cause this bladder cancer. So they're supposed to help cancer, but then they could irritate the lining and increase the frequency of cancer. So the manifestations for bladder cancer include painless hematuria, right? So this is the case in which we have blood cells in our urine, but it is not associated with pain like we would see with a UTI. Okay. Just like previously in tumors, we can expect urine discoloration. So the glomerulus is not functioning correctly, and so it's allowing structures and substances, not structures, but it's allowing substances to pass through the glomerulus, entering the urine. And this can produce a urine that is dark, rusty, or brown color, similar to what we've seen before in other urinary tumors. Frequency of urination, so you can increase how often the need to go to urinate is, because the pressure is applying, or the tumor is applying pressure to the bladder and the fluid within, right, which is causing the stretch receptors to stretch, and we're getting more action potential sent to the spinal cord for that reflex to occur, causing contraction of the detrusor muscle. We get dysuria. Okay. We can see urge incontinence, so we can see this urge incontinence being stretch. And so urge incontinence is only a brief sensation and then release of urine. UTIs can be manifestations, and it's from incomplete emptying due to the tumor presence. Okay? And then we could experience some back and abdominal pain. Usually it is referred pain, because we're not really feeling much from this specifically, and we don't have neurons coming solely from the bladder. They are joining up with other neurons from the body. Okay, so how are we going to diagnose bladder cancer? We're going to be trying to ID the tumor and identify if metastasis has occurred, right? So, to do this, we're going to try to collect information regarding the patient history and physical examination. So, next, we're going to supplement this with imaging techniques: X-ray, MRI, CT scan, PET scan, bone scan, intravenous pyelogram, cytoscopy. Okay. So any number of conditions, and really the cytoscopy is going to be helpful here, in addition to the X-ray, MRI, and CT scan. Whereas some conditions, like in renal cell carcinoma, the cytoscopy wasn't overly helpful, in my opinion, because we couldn't actually visualize the tumor. Okay. Next, we are going to run lab tests, and so we might run a liver panel. And so the liver panel would be indicative of if it is metastasized to the liver, because now we're going to see abnormal proteins, and so the liver is a very large producer of serum proteins. We're going to run a urinalysis looking for a presence of urine proteins, proteins found in the urine like albumin and fibrinogen, but also due to markers. So we're going to base our treatments off the standard cancer, and so we're going to be based on staging. So we're going to look at the staging of the tumor, and so we go all the way up to 4, right? So the stage 4 tumor is the largest largest tumor formation in there. Okay. We're going to try to use surgical techniques, okay, and radiation and chemotherapy as needed. We might use immunotherapy to help us with this disorder. So, all right, well, that's our audio lecture over. That's our audio lecture over bladder cancer. Okay. And so we're going to want to really understand the differences between the different types of urinary tract cancers. So really today we've introduced 3 We've introduced Wilms, we introduced renal cell carcinoma, now we've introduced bladder cancer. And the follow-up lecture I'm going to post is over benign prostatic hyperplasia.